ServSafe Manager Chapter 14 Exam Questions. Food Service Inspectors. Required for all operations. Lets an operation know if it is meeting minimum food safety standards, based on local or state regulations, often based on the 5 risk factors and FDA public health interventions. The Public Health Service, PHS. Assist the FDA, USDA, and state and local regulatory authorities, conduct research into the causes of foodborne illness outbreaks, assist in investigating outbreaks. Food and Drug Administration, FDA. Inspects all food except meat, poultry, and eggs, regulates food transported across state lines, issues the FDA Food Code. What to do after an inspection? Discuss violations and time frames for correction. Be sure you understand the violations. Keep copies of the report on file. Act on all deficiencies within the required time frames. Determine the causes and take corrective action. 1. Revise or create procedures. 2. Communicate with staff. 3. Retrain staff. FDA Food Code. Contains federal recommendations for food safety regulations, created for city, county, state, and tribal agencies that regulate restaurants and retail food stores, vending operations, schools and daycare centers, hospitals and nursing homes, is recommended, but not required, to be used by states. What to do before an inspection? Make sure staff know who is in charge of food safety. Be aware of your company's policies for inspections. The state and local authorities. Inspect operations, enforce regulations, investigate complaints and illnesses, issue licenses and permits, approve construction, review and approve HACCP plans, write or adopt food codes that regulate retail and food service operations. How to evaluate your facilities for risk designation. Priority items, prevent, eliminate, or reduce hazards, example, handwashing priority foundation items, support priority items, example, soap at a handwashing station core items, relate to general sanitation, the facility, equipment design, and general maintenance, example, keeping equipment repaired. What to do during a self-inspection. Use the same type of checklist that the regulatory authority uses. Identify all risks to food safety. After the inspection, meet with staff to review problems. Benefits of self-regulation in the restaurant and food service industry. Increased understanding of foodborne illness and its prevention, improvements in the safe design of equipment and facilities, industry-wide initiatives to maintain safe food during processing, shipment, storage, and service, efforts to make food service laws more practical, uniform, and science-based. 6 reasons why an inspector may close an operation. Significant lack of refrigeration, backup of sewage into the operation, emergency, such as a fire or flood, significant infestation of pests, long interruption of electrical or water service, clear evidence of a foodborne illness outbreak related to the operation. Benefits of doing your own self-inspection. Safer food, improved food quality, cleaner environment for staff and guests, higher inspection scores. The Centers for Disease Control and Prevention, CDC. 1. Agencies of the U.S. Department of Health and Human Services. 2. Assist the FDA, USDA, and state and local regulatory authorities by providing these services, investigating outbreaks of foodborne illness, studying the causes and control of disease, publishing statistical data and case studies in the Morbidity and Mortality Weekly Report, MMWR, providing educational services in the field of sanitation, conducting the Vessel Sanitation Program and Inspection Program for cruise ships. What to do during an inspection. Ask the health inspector for identification. Prohibit entry through the back without the correct ID. Ask for the reason for the inspection. Do not refuse entry. Cooperate with the inspector. Take notes. Keep the relationship professional. Be prepared to provide requested records. U.S. Department of Agriculture. Regulates and inspects meat, poultry, and eggs. Regulates food that crosses state boundaries or involves more than one state.